Welcome to Health Talk. Today we are going to explore the opportunities found in Pikeville Medical Center's Outpatient Rehabilitation Department. You will learn about many of the special therapies offered to our patients, how unique the PMC outpatient services are, and we will visit with a therapist who work directly with our patients. Let's begin our program with Debbie Puckett, Pikeville Medical Center's Vice President of Rehabilitation and Wound Care Services.
Hello, I'm Debbie Puckett, and I'm a physical therapist, and I'm the Vice President of Rehabilitation and Wound Care Services at Pikeville Medical Center. I came there in 1973, and I was the first physical therapist at Pikeville Medical Center. It was very exciting to start a new service, and now 39 years later, it has amazed me what we now can offer to the patients in this region. We have added not only physical therapy, but occupational and speech therapy. We have care throughout the continuum. You can get all three therapies when you're in the hospital, in home health. You can get it on the 10th floor in the rehabilitation hospital. And we also have this beautiful outpatient rehabilitation facility that's in the Riverfield. It's very accessible, and it is large and spacious with a large gym area, many exam rooms, an aquatic pool for you patients that cannot tolerate land therapy. I just can't believe it. We have over 50-some, maybe 60, I believe, rehabilitation professionals now to take care of your needs. That's why I'm so excited today that we're going to have therapists who are specialized. Our physical therapy and occupational and speech therapy department is different because we have sent our therapists for extra training, and they have become certified, and they have technology that no other department has in the region. Like I said, you can get the pool therapy. We have balance therapy for people to prevent falls. We have vital stim therapy, so the speech therapists use that to help you swallow. We have a computerized robotic arm that the occupational therapists use to help you recover. We have a computerized ambulatory machine. The Locomat is robotic, and it can help you walk again. It's unbelievable what we have. We also have a therapist that's certified in lymphedema management, so if you have the chronic swollen extremities, she can help you with that. We have a pediatric certified therapist. I just am so thrilled that we can offer these services to the people of the region, and so now we are going to get to meet those therapists who will actually be providing that care for you. We also have a therapist that's certified in functional capacity evaluation, where we can see if you're still disabled or if you can do your job. So now let's meet our therapist as they explain their specialties and their equipment to you.
My name is Shalonda Brown. I'm a physical therapist. I've been here at Pikeville Medical Center for 3 years, and today I'm going to be talking about the aquatic therapy. I'm one of the therapists that works with the aquatic therapy. I have a couple physical therapy assistants that also help, and several technicians that help me with this program.
What kind of patients could benefit from aquatic therapy?
The aquatic therapy is very beneficial for a lot of different patients with different diagnoses. First and foremost, it's patients who cannot tolerate land-based physical therapy. Maybe it's too painful, or for some reason they're just not able to tolerate it. Normally they do really well with the aquatic therapy. We have different diagnoses. Total knee replacements, we put patients in the pool before and after surgery. It's very beneficial for that. A lot of patients with arthritis, fibromyalgia, patients with multiple sclerosis, a lot of different diagnoses can benefit from aquatic therapy.
What type of results do patients see from aquatic therapy?
With the aquatic therapy, a patient can expect to have improved mobility, increased flexibility, arms and legs. Also, we can improve the strength in your arms or your legs with the aquatic therapy. Again, with a total knee replacement, it works very well because we can increase the range of motion in their knee flexion and extension. We can also improve their ambulation and their gait. If they have any kind of a limp or gait deviation, the aquatic therapy is great to help improve that and have them exercise without having as much pain. We use a lot of exercises, different exercises in the pool. We have different products that we can use. We have barbells that we can, or dumbbells that we can use with the patient using as resistance in the water. We usually do about chest depth water with that. We also have an aerobic step. It's a 6-inch aerobic step that we have patients can step up and down. If they have difficulty going up and down steps at home because of pain, they can go up and down steps here in the water without having the pain. We have an underwater treadmill with our pool. It's one of the best features of the HydroWorks pool. And patients can actually walk without a limp in the water, where on land-based therapy they normally have a limp. So it's very beneficial to help increase the strength in the legs and resolve their limp that they may have from surgery or just from an injury.
Are there some patients that cannot get in the pool?
There are certain people that cannot get in our pool. There's some contraindications or precautions that we always follow. Any patient that has an open wound anywhere on their body, we cannot put them in the pool due to the infection. We don't want to make sure we prevent any type of infection for any other patients that may be in the pool. Also patients with any type of incontinence, again, for preventing any type of spread of any type of diseases or anything. And patients that have fear of the water. If you're too afraid to get in the water, we try to assist as best we can, but if you are too afraid, we'll attempt land-based therapy before we do any aquatic therapy.
Do I have to be in the pool with other patients?
One of the most common questions that I get asked by patients is, are there going to be other patients in the water at the same time? And the answer is no. We only put one patient in the pool at a time. I do get in with the patients. I also have a technician that she and I coordinate, and she'll get in if I'm not in and be in with the patient. There is a privacy issue with patients. We want to make sure each patient feels comfortable in the water, and that's another reason why we only work with one patient at a time while we're here.
How long can I receive aquatic therapy? And does my insurance cover it?
Another commonly asked question by patients is, will their insurance reimburse for aquatic therapy, and how long can they attend aquatic therapy? Normally we see patients at a frequency of 2 times per week for about 4 to 6 weeks. And yes, most insurance companies will reimburse for aquatic therapy. The biggest problem is limitation by some insurance companies, but each insurance is individual, and we can determine that once you receive your order for the aquatic therapy. Okay. The aquatic therapy program is based on a physician referral. If you think you could benefit from the aquatic therapy, you can contact your physician, have them send us a referral. If you want to contact me here at the hospital, I'd be happy to talk to you. If you want to come in and see the pool, that would be an option as well. Any questions you may have, you can just contact us here or see your physician, and we can get you set up on an aquatic therapy program.
My name is Kenneth. I'm a physical therapist with Pikeville Medical Center. I've been here for about 5 years. I want to thank you for choosing Pikeville Medical Center, and I'm here today to answer any questions about the Balance Master.
What is the Balance Master?
The Balance Master is a machine that's hooked to this computer that tests the systems that control balance, your vision, your vestibular, and your somatosensory, which is the sensation from your feet.
What type of patients would benefit from the Balance Master?
There's all kinds of different patients. We got stroke patients, head injury, sports medicine, orthopedics, anybody that's having trouble with balance or feeling unsteady or have a high risk of falling. We can come in and do an evaluation and then determine whether it would benefit you or not.
What does the Balance Master tell you about the patient?
I'll do a series of testing, and it will test each system that controls balance, the vision, the vestibular, and the somatosensory, and it takes each of those and tell me which one is not working as well, and then that will let me know what I need to work on, and I can set the machine up where it will just help strengthen those which system is not doing so well.
Tell me about the treatments that are performed on the Balance Master.
We can do all kinds of different treatments, like trunk control, strengthening of the ankle, knee, and hip, anything with weight shifting. If you've suffered a stroke and you're having trouble getting onto your right or left side, we can set it up where it'll do that or help strengthen your vestibular system. Your vestibular system is part of your inner ear that helps control your balance. You have small semicircular canals that has fluid in them, and they flow in and out to keep your balance, and sometimes those don't work as well for various reasons depending on your diagnosis, and we can help strengthen that with this machine. Once you're in the machine, we will hook the harness to the clips, and then we will place your feet onto the platform, and I will instruct you, try not to move them unless you absolutely have to, but if you do, then we can fix them back. And then once I start the machine, I'm going to have the wall and the floor will move some, and then the little man on the screen is you. You're going to weight shift forward and backwards, and then there are going to be yellow boxes that pop up. Try to shift your weight to those and hold those, and then that'll last for about 2 minutes, and then we'll move on to the next exercise. Once you're finished with Balance Master therapy, you can expect to be more steady on your feet and not lose your balance as much, walk better through stairs and uneven terrain like out in the grass or gravels. And if you're more of a sports type person, you can get a little bit stronger in your knee and ankle and with balance activities for your sports.
My name's Vanessa Goble, and I've been at Pikeville Medical Center now for 7 years. I'm here today to answer any questions you might have about the functional capacity evaluation.
What is FCE?
An FCE is the functional capacity evaluation. It's a series of dynamic tests that are designed to determine an individual's functional and physical capabilities and tolerance.
What is the purpose of an FCE?
The purpose of an FCE, the functional capacity evaluation, is that it will help us as far as a safe return to work. It also gives information for settlements in auto accidents, long-term disability, or workers' comp cases. It can let us know if there's other services that might be needed, such as pain management, work hardening, work conditioning, and it helps doctors determine maximum medical improvement.
How long does it take?
An FCE usually only takes 1 day, and it lasts up to 4.5 hours. But depending on the diagnosis, we can spread it out over 2 days, and it shouldn't last any more than 3 to 4 hours.
Hello, my name is Gina Stanley. I'm a speech pathologist. I've been working here for 5 years, but I have been a speech pathologist for 21 years. I'm here today to talk to you a little bit about VitalStim.
Tell me about VitalStim.
VitalStim is a new treatment option that we have for our patients who have dysphagia. It has been approved by the FDA for the treatment of the muscles of swallowing. With VitalStim, we can target specific muscle groups to improve the swallowing function.
What is dysphagia?
Dysphagia is defined as difficulty with swallowing. People who are having dysphagia will notice problems with choking, excessive throat clearing, frequent congestion, some fevers after eating, and frequent pneumonia.
Who is a typical VitalStim patient?
Our VitalStim patients are typically stroke patients, people who have neurodegenerative diseases, and those who are exhibiting any symptoms of dysphagia.
Who provides this therapy?
We have a doctor who will write the order for VitalStim therapy. The therapy is actually provided by the speech-language pathologist who has been certified to perform the VitalStim therapy.
How does VitalStim therapy work?
When you arrive for VitalStim therapy, you will be assessed by the speech pathologist to determine if you are a candidate for VitalStim. First, we determine the placement of the electrodes on the neck. We do that by feeling for the swallow and referring back to the modified barium swallow so that we know specifically which area we need to target. That will determine the position of the electrodes. When the electrodes are attached, we'll turn the machine on. We go up in gradual stages. You'll feel a stinging sensation at first that goes away very quickly. That will be replaced by a tugging, pulling, or tightening of the muscle field. It can be a little bit uncomfortable, but typically after a few minutes, it eases off and it is more tolerable. The session will last for approximately 60 minutes. Throughout the session, we will gradually be increasing the level of the VitalStim so that the pulses get a little stronger. The stinging sensation typically does not come back. You'll just feel more and more tightening of the muscles. During the therapy session, we will be either doing some traditional swallowing exercises to enhance the VitalStim, or we will be doing trials of ice chips to rehearse the swallow. If you feel that VitalStim would be beneficial to you for your swallowing function, you can contact your doctor for a referral for VitalStim. If you have any questions, feel free to call us and we'll be happy to answer any questions that you have.
Hi, my name is Susan Molina. I'm an occupational therapist here at Pikeville Medical Center. I've been a therapist for about 19 years and I've been here at Pikeville Medical Center for about 5 years. And I'm happy to answer any questions you have about the Armeo Spring.
What is the purpose of the Armeo Spring?
The RMAO spring works on the concept that the brain has neuroplasticity, which simply means that the synapses and the neural pathways are changeable or moldable. So the object of the RMAO spring is to bombard the brain with task-oriented activities that will change it to create new pathways that will lead to more movement for a weak arm. So working off of that concept of neuroplasticity, it uses computer-generated games and activities that encourage active movement of a weak arm. It can work to help increase range of motion, strength, and active movement and coordination of a weakened, affected arm.
The RMAO spring, how does it work?
The RMAO spring has an exoskeleton that the patient's arm rests in, and it supports the arm and counterbalances it. So if it's too weak, it'll give it a little bit of help against gravity. Because of this support, it can help to bring out any really weak movements that the arm may have.
So who would benefit from using the RMAO spring?
The RMAO spring may assist patients who have a weakened arm or hand that has resulted from some type of neurological deficit or insult, such as a stroke or traumatic brain injury. If you have any questions about the RMAO spring, you can call. We'll be happy to answer any questions that you have. If you think that this might be beneficial to you, please feel free to contact your physician and ask for an order for occupational therapy, and we'll be here to help you. Thanks.
Hello, I'm Sharon Stanley. I'm a physical therapist and I'm a certified lymphedema therapist. I've been a practicing therapist for 22 years and I've been here at the Pikeville Medical Center for the past 14 years. I received my lymphedema certification 4 years ago and have specialized in that treatment since. And I'm here to answer any questions that you might have about lymphedema.
What is lymphedema?
Lymphedema is basically chronic swelling and can involve any body part. It primarily is seen in the arms or the lower legs, but swelling can develop in various areas of the body, especially if it's related to different cancer diagnoses or radiation treatments.
Who is at risk for lymphedema?
The most popular diagnosis related to lymphedema is breast cancer. However, this disorder is commonly seen in men following prostate cancer, also various types of surgeries where the lymphatic vessels may be destroyed. It's common following radiation treatments, and surprisingly, this condition is frequently seen in patients who have disorders of congestive heart failure, kidney disease, diabetes, venous stasis, as well as some birth disorders that aren't diagnosed until later in life.
What are the key treatment methods for lymphedema?
There are several treatment options for this disorder, but the key component of treatment is compression therapy. I primarily start with a compression type wrap, and as long as the patient responds well and doesn't have any difficulty with the wraps, we continue with those until they can be fitted with an appropriate compression sleeve, glove, or sock. If the patient doesn't respond as quickly with compression alone, I'll tend to add some of the more time-involved treatments.
My name's Shalonda Brown. I'm a physical therapist. I've been a therapist for 12 years. I've been here at Pikeville Medical Center for 2 years. I've been working with the Locomat since it has arrived here at Pikeville Medical Center. Myself and 4 other therapists have been trained in using the Locomat, and we are also now certified trainers that we can train other therapists to use the Locomat. So we're very excited about it being here and excited to let the community know what it is and everything about it.
Hi, my name is Tracy Tipton. I've been a physical therapist here at Pikeville Medical Center for the past 14 years. I have been working with the Locomat since its arrival here in Pikeville. I'm also been certified with Shalonda on the use of the Locomat and to train other therapists. I'm excited here to tell you today about how we can help you and your family members' needs and how to get your walking better.
Locomat? What's a Locomat?
The Locomat, how I like to explain it to patients initially is it's a robotic device that helps you get back into your normal walking pattern. What it is you're strapped into this machine and your legs are hooked onto the robotic pieces, and it gets you back into a normal walking pattern and versus a slide or a step 2 pattern or something that is not normal in the community. We want to get you back into your fluid movements, back into the way a normal person walks.
Also, it does have a harness that is attached to you that will keep you up in the air, so it's very safe, very secure. We will be there with you at all times. There's always at least 1 or 2 people with you. You're never left with a Locomat. And again, it just helps you to walk. It teaches you your normal walking pattern. Whatever the reason that you're having difficulties walking, this machine will help you get back to a normal pattern.
What conditions can be treated with a Locomat?
The Locomat can be used for several different types of patients with different diagnoses. We use it a lot with spinal cord injury patients, stroke patients. We also have a pediatric portion to our Locomat, so we have children that we can put in the Locomat that possibly may have cerebral palsy. Any type of diagnosis or treatment that you need to assist you with walking, that's what the Locomat can do.
Some other conditions that can go in is patients with multiple sclerosis, patients with balance issues. I had one particular patient with cerebellar ataxia. The cerebellar ataxia, for those of you that are unfamiliar with that term, it's the cerebellum is what controls the balance in your brain, and so if your balance is off, the Locomat can get you back on your feet again in a straight pattern to walk in a straight line versus all over the place.
There are some patients that will not be able to use the Locomat. We have several restrictions. One is if you have a significant leg length discrepancy, if one leg is much longer than the other or shorter, will not be able to use the robotic legs. It will not work. If the patient is over 300 pounds, also the Locomat does not support that, so they will not be able to use. And if they have significant osteoporosis, would not be recommended to use the Locomat due to the diagnosis of osteoporosis. And the reason we cannot use the Locomat with patients with osteoporosis is it can be more detrimental to them than beneficial due to the diagnosis. It is a brittle bone disease, and it just can will not benefit the patient. It would hurt them more than it would help them.
Some of the other contraindications for use of the Locomat is patients who have recently had any kind of surgery or have any staples or wounds anywhere on their abdomen or their legs, anybody with a broken hip or broken bones in their legs, and anybody with any open wounds could really hinder their use of the Locomat.
How does the Locomat work?
Well, we get a referral for the Locomat and from the physician, and we assess the patient if they're able to tolerate being upright and standing. If the patient cannot be standing on their feet for any length of time, then they're not appropriate for the machine. We also will make sure that they've covered all of the indications for the treatment, have a good diagnosis, and they have a bad walking pattern. We will attempt to put them in the Locomat. And the first step is to get the measurements. We measure the length of the leg, we measure the length of the bottom part of the leg, the top part of the leg. We will measure their circumference of their thigh, their calf, and their ankle so that we can get all the right body parts onto the machine so that it would fit their body accurately.
If the patient is able to walk, we have an incline that goes up to our Locomat, so we can assist them up to the Locomat. If they cannot walk, we will put them in a wheelchair and push them up to the Locomat. There are harness straps. Once we fit them with an appropriate belt to their size, we strap everything in. We will assess their size for the belt before we put them in the machine. We will put the harnesses and strap. There's 4 straps, and we will put that on there. And then we will put each leg, there's 3 leg cuffs, and we will put each of those on their thigh, their calf, and their ankle, and strap all that in and get them in nice and snug before we can begin the walking patterns with the patient.
Once you're strapped into the Locomat system and you're raised up in the air is when you'll feel the most pressure around your abdomen, your stomach, and your groin a little bit too. That's where the harness is actually taking the weight off of your legs and lifting it up onto the Locomat system. Once you're up in the air, we've got everything hooked up and we're ready to start the walking process, the first thing you will do is you walk in the air. and that just gives you an idea of what it feels like, how it's going to move you. Once you get comfortable with that, then we put you down a little bit towards the treadmill. The next phase in the Locomat training is what we call kissing. We will lower you down to where your feet are just barely touching the treadmill. This is our time to look and see and make sure that your foot is clear on the treadmill, that your knees bending when it's supposed to be, your hips are bending when they're supposed to be. And this is the time when we take extra measure, which we do through the whole process for safety, making sure that the harness is on right, where the leg straps are on right, and that you are comfortable as you can be in this machine.
After the kissing phase is where we actually will put a little more of your body weight onto the treadmill. Again, we will be with you at all times. There will always be a therapist with you. We will not leave you. There is a safety button on the machine. If at any time that you need to get out of the machine, we can get you out of the machine quickly. We just want you to be safe. We want you to be walking normally, and we want you to be safe during the process of being with a Locomat. There are different ways you can progress. After the kissing portion of the treadmill, we can progress the patient by lowering more of their body weight onto the treadmill while they're walking. We also can increase the speed of the treadmill, and we can increase the resistance added to the treadmill while the patient is walking. There is a monitor in front of the patient at all times that gives the patient feedback as to how much they are working or how much the machine is working. We will tell you, as the therapist beside the patient, we will tell you when to work harder or when you can relax and let the machine do it. There are safety stops on the machine. If at any time you feel uncomfortable or you feel like you need to be out of the machine, we can get you out. We also, as a therapist sitting beside you, will have what's called a telestop, which is a small button that we will push every 3 minutes to make sure that we stay with the patient. It's just a safety portion of the Locomat that all Locomat users will have to use. We do have a pediatric attachments to the Locomat. We are very blessed to have that. We are one in 17 facilities that has that in the country. We're the only one in the state of Kentucky that has the pediatric portion of the Locomat. So we are very blessed and very excited to have that and offer that.
I hope you learned something today about our outpatient rehabilitation services and our equipment and therapists. But I also wanted to remind you some of the basics that physical therapists have always provided. Physical therapists are the best professional to see if you have any joint or muscle injury or pain, whether it's your neck, your back, a frozen shoulder, bursitis of the hip, plantar fasciitis of the foot, arthritis of the knee. It doesn't matter. Physical therapists are trained to evaluate and analyze your muscles, and we can educate you to prevent injuries in the future. Not only do we use things as heat, ultrasound, electrical stim, massage, mobilization, we can do all of that, but we also find out where your muscles are imbalanced and weak, and we can re-educate you so that you can prevent injuries in the future. So whether you've had a car wreck or you just wake up and don't know why your neck or back are hurting, we can take care of those things in physical therapy. And remember, if you ever have any issues like this and you need physical occupational speech therapy, generally we can get you in the very same day. So don't worry about having to wait to get the care that you need.
Thank you for joining us for Health Talk. If you have questions about our services or how you can become a patient at Pikeville Medical Center's Outpatient Rehabilitation Department, give us a call at 606-218-3506.